My name is Francesc Bosch. I'm head of department in the University Hospital Vall d'Hebron in Barcelona, and also chairing the CLL lymphoma group in Spain. So I'm a CLL expert. So there are, I would say, three aspects that are interesting in this ASH. First is the long-term results of the new drugs, particularly ibrutinib. So this proof that ibrutinib is keeping the activity in CLL, even in frontline or refractory patients, showing a clear benefit for progression-free survival and overall survival in those settings. So that was interesting data, consolidating what we knew on the activity of ibrutinib in CLL. Second thing is the appearance of new data for new drugs, particularly venetoclax. Venetoclax is a very interesting drug in CLL, and we saw data on venetoclax alone and combined with other drugs. Very interesting data. Venetoclax is a very active drug, very promising, obtaining what we call negative MRD results. So we are not able to detect the presence of CLL in bone marrow and peripheral blood. The third thing is more innovative, are the results of CAR T cells. CAR T cells is a new technology for CLL. Interesting results on the activity of CAR T cell therapy in clinical trials, still experimental therapy for CLL, proving that it's an active therapy for those patients that are not candidate for the new drugs. So it's a way to salvage patients that are progressing or are intolerant to the new drugs. Results are promising. Still, I think there are things to be sorted out in terms of possibility of expansion of T cells in CLL, because not all the patients are able to expand T cell subpopulations. And duration of responses, apparently there are excellent responses, but those are not so durable. So we have to sort out to imagine what's going on. So in this ASH, there were some biomarkers predicting the duration of response in CAR T cells. So I would say there are those three things: consolidation of the data of the new, not already new drugs, so 5 years of follow-up, new combinations with new drugs, and the CAR T cells. I would say that this is the highlights of CLL.